Good evening or good day once again. So this is now the continuation of our screencast for the Gram Positive Bacilli. So I think I was able to discuss before to you some of the important Gram Positive Bacilli. We have already discussed Clostridium, Bacillus, and Corynebacterium. So this is just a continuation. So again, please bear with me if you'll be hearing barking dogs in the background. Okay, so I'm just recording this in my room. Anyway, to start with, let us discuss one of the most important gram-positive bacilli that we have here. And this is the Listeria monocytogenes. The term monocytogenes might be intriguing to you, okay? Because of the fact that once you are infected with these particular organisms, there would be abundance or preponderance of monocytes in the blood smear of the patient. So anyway, general characteristic, this is a gram-positive cocci. They are non-spore former, and sometimes they appear like a cocobacilli, but and sometimes they would appear like cocci. So the term cocobacilli, for you not to get confused, is actually a transition between a cocci and bacilli. So they are kind of plump like this. Okay. So they are widespread in nature, and we could consider these as a zoonotic infections because they would primarily infect animals. So that's the reason why human exposure of this particular infection is limited. So mostly affecting neonates or those people who are said to be immunocompromised. And since this is an animal infection, or an animal zoonotic infection, there's a possibility that we would be seeing this in dairy products, particularly those that were not properly pasteurized, because it could grow even at low temperature. Okay? And it could also be seen in processed meats such as cold cuts, so there's a chance that you might get Listeria contamination. So Listeria monocytogenes therefore could also be considered as a foodborne pathogens. Okay, so I already mentioned that if you are infected with Listeria monocytogenes, there would be increased monocytes in the blood. Okay, so there are cocobacilli. Sometimes it could be confused with diphtheroid. So a diphtheroid is a small Corynebacterium that are usually normal microbiota. Okay, so later on there would be a differentiation between Corynebacterium and Listeria. Okay, so one of the most important characteristic or something that is very peculiar to Listeria is the so-called tumbling motility. Okay, tumbling motility, usually seen at room temperature, and it's very rare that you'll be able to see the motility at 35 degrees centigrade. So later on, you'll also be able to see an illustration that Listeria monocytogenes could produce an umbrella-shaped motility. So if you're going to inoculate this in the back of a semi-solid medium, so you'll be able to see an inverted umbrella-shaped motility. So in Columbia CNA, the colonies are said to be smooth, translucent, slight rays with distinct blue-green color. One of the tests that could confirm the presence or could screen for the presence of Listeria monocytogenes is called an Anton's test. Anton's test would be using guinea pig. So we usually place 1 to 2 drops of bacterial suspension in the eyes of guinea pig, and there would be swelling or inflammatory reaction of the guinea pig. Then that is considered as a positive result. Okay, so infection with Listeria is generally called listeriosis. Okay, so it's very rare that we would see human infection, but in cases of human infection, particularly in adults, septicemia and meningitis could be seen. But this is primarily because of the fact that these individuals could be immunocompromised or among the elderly, because the immune system is not as good as compared to the young adults. So in adults, it would likely develop disease from penetration of the intestine, which means that you might get it from ingestion or systemic spread. So eventually, the systemic spread would result into septicemia and meningitis. Okay, so endocarditis would also be possible. Pregnant women could also be at risk of getting listeriosis, but they would just exhibit mild flu-like syndrome. And however, though it would only be a mild flu-like syndrome for pregnant women, it could be fatal to the fetus because of the fact that it could eventually inadvertently result into premature labor and spontaneous abortion. So, in pregnant women, of course, the neonates could be affected because of the fact that there is a chance of intrauterine transmission. This could result into neonatal sepsis. So, neonatal sepsis is one of the results of having this particular type of infection. So, neonatal sepsis and neonatal sepsis is said to have a very high mortality rate. Okay, at a later onset, it could invade the blood-brain barrier system, thereby causing meningitis. Relatively speaking, meningitis would have a lower mortality rate as compared to neonatal sepsis. And of course, I've already did mention that immunocompromised individuals could result into CNS infections such as in meningitis, or it could also result into endocarditis. So, this is the characteristics of Listeria monocytogenes as seen in Gram stain. So, as you can see, they would exhibit the Gram Positive Bacilli, Bacilli. So, this is the Gram stain of Listeria monocytogenes. For the cultural characteristic, these organisms could grow on blood agar plate. And in blood agar, they would actually produce a narrow zone of hemolysis. This narrow zone of hemolysis could be similar to the group B Streptococcus. If you could remember our previous lesson, it's Streptococcus agalactiae. However, to differentiate it, Streptococcus agalactiae would produce the arrowhead hemolysis. Okay, whereas Listeria monocytogenes would produce a narrow zone of hemolysis. Okay, as you could see here, this is an example of a narrow zone of hemolysis. Okay, there is another species of Listeria, Ivanoville. Okay, they won't have the yellow coloration, which indicates that there is a presence of hemolysis, unlike for here in Listeria monocytogenes. So, cold enrichment is one of the screening or enrichment method for Listeria monocytogenes, because of the fact, as I did mention a while ago, that they could actually grow at cold temperature. Now, since they would produce hemolysis that might be similar to group B streptococci, you might as well perform the catalase test. So, streptococci, if you could remember, would be catalase negative. Listeria monocytogenes, on the other hand, would be catalase positive, so that you won't get confused whether the colonies that you're seeing in blood agar plate is a Listeria or a streptococci. So, they are also negative for hyperate hydrolysis. So, again, motility is one of the most important characteristics of Listeria monocytogenes. At room temperature, they would produce umbrella-type motility. And if you're going to prepare a hanging drop preparation, it would result into tumbling motility. Just to remember how to perform the hanging drop method. So, in hanging drop method, what you'll have here is a concave slide. It's not your ordinary slide because a concave slide would have an area of depression, so that would hold the solution or the bacterial suspension. So what you're going to do is that you have to place petroleum jelly at the side of the cover slip, and then you add the bacterial solution, 1 to 2 drops of bacterial solution here. And then, after that, you invert now the concave slide. So, this is a concave slide. So you invert it and see to it that the concave area here would be at the exact position where the solution or the droplet is. Okay, so in side view, it would appear like this. So if this is the cover slip that contains the petroleum jelly and the solution. Okay, so you place now the concave slide here. So you invert. So that's the reason why it's called hanging drop. Then you observe the motility. Okay? So you'll be able to see the tumbling motility. Sounds interesting, right? So this is the umbrella-shaped motility. Okay. So the caption says here, umbrella motility is the motility test for Listeria monocytogenes, showing typical umbrella pattern which occurs toward the surface of the medium when this organism is incubated. Take note, at room temperature. So tube on the left is positive, tube on the right is a negative control. So you'll be able to see here the umbrella-shaped motility. So this is just a motility. So by the way, if you could recall motility in biochemical tests, motility is considered as growth away from the site of inoculation. So for example, this is your bath. If you're going to inoculate the organism here in the bath, so you would expect that if it's positive for motility, the organisms would move away from the site of the inoculation. So that is considered as a positive result. And if the inoculation is, or if the pattern of motility is said to be an umbrella, then it could be positive for Listeria monocytogenes. Okay, CAMP test. Do you recall what the CAMP test is? CAMP test stands for Christie, Atsky, Munch, Peterson. Okay, so it may sound familiar to you if you have already studied gram-positive cocci. Christie, Atsky, I hope I got the spelling right, Munch, Peterson. Okay, so anyway, the CAMP test, okay, is the reason why you might be familiar with this is because we're using this for the identification of group B Streptococcus or the Streptococcus agalactiae. If you could recall, Streptococcus agalactiae would produce an arrow-shaped hemolysis, okay, such as this one. This is the arrow-shaped hemolysis of Streptococcus agalactiae. Whereas, for the Listeria monocytogenes, okay, it would produce the so-called black type of hemolysis. Okay, black type of hemolysis is like this. Okay, like this for for Listeria monocytogenes. It's not arrowhead, but it's a black type of hemolysis. So again, this is a clearer view of the black type of hemolysis. Okay, so as you can see, okay, it's not an arrowhead as compared to Listeria as compared to Streptococcus agalactiae. So, by the way, this colony here is a colony of, Listeria monocytogenes. So, we usually inoculate it beside the colonies of Staphylococcus aureus. So, this would be the colonies of S. aureus, whereas this would be the colonies of Listeria monocytogenes. Okay, another one. Okay, so could you identify what is letter A, what is letter B, and what is letter C? Okay, so wrong, Kevin, wrong. Okay, letter A is Streptococcus agalactiae. Letter B is Listeria monocytogenes. Letter C is Staphylococcus aureus. Okay, so remember this illustration. It might appear in the exams. Okay, so how do we differentiate Listeria from other gram-positive bacteria? This table is very important because during the introduction, I told you that sometimes if you're just looking at the morphology, you might mistake Listeria monocytogenes for diphtheroids, a small variant of Corynebacterium. So, how do you differentiate them? Well, of course, you could look at the catalase test. For the catalase test, only Listeria and Corynebacterium would be negative. Strep agalactiae and Enterococci would be negative, of course. For esculin hydrolysis, Listeria would be positive. Okay, Enterococcus would be positive. So that way, you are now able to differentiate it from Corynebacterium and from Strep agalactiae. And for motility, okay, the one that is truly positive is Listeria. Though Corynebacterium would have a varying results for this. And for beta hemolysis, okay, both Listeria and Strep agalactiae would be positive. But remember, Listeria monocytogenes would produce the black hemolysis, while Streptococcus agalactiae or the group B Streptococci will produce the arrowhead hemolysis. Okay, Listeria would be capable of growing in the presence of 6.5% sodium chloride. So that makes them what? That makes them halophilic. So I forget for a while. Halophilic. Or halotolerant. Okay, halotolerant because it's just 6.5%. So again, another illustration of Listeria monocytogenes showing the Gram Positive Bacilli and the growth in blood agar plate. Okay, so this is just an illustration of the tumbling motility for you not to forget. Okay, so another, this one is a better illustration of the umbrella-shaped motility. So literally looks like an umbrella for your summer. Okay, now another organisms that is part of the Gram-positive bacilli would be the Erysipelothrix rhusiopathiae. So be sure that you will not misspell Erysipelothrix. Rhusiopathiae. The term rusio means red, and pathiae refers to the disease, which by the way is erysipeloid. So again, this is another example of a zoonotic infection. So this is a zoonotic infection. So the organisms are said to be pleomorphic, which means that they assume a variety of shape. They are microaerophilic, non-motile. In blood agar plate, they would produce alpha hemolysis. So which means that there would be a greenish-brown zone of hemolysis, since alpha means the hemolysis is incomplete. So there would also characterized by the presence of the lump brush or test tube brush colonies. Colonies are barely visible for at least 48 hours. So you have to incubate it for a minimum of 48 hours. If you're using the potassium tellurite medium, so they would produce the black colonies. Black colonies, by the way, is indicative that they are capable of producing hydrogen sulfide, particularly in TSI. But Erysipelothrix rhusiopathiae is catalase negative. So they are widely distributed in nature. And since they are zoonotic infections, so swine, turkey, and sheep are most commonly affected. So I told you that this could cause erysipeloid, and it comes with an occupational hazard. So who are the people that are at risk, of getting this infection? So maybe those who are tending these animals in the farms, the shepherds, or those who are working with pigs in the piggery. So there's a chance that they might get erysipeloid. However, erysipeloid is self-limiting and it's just a localized infection. So usually affecting the hands or the fingers that could heal within 3 to 4 weeks. A much worse type of infection would be the endocarditis, because this now entails the inflammation of the endocardium of the heart. It may occur in those who have had valve replacement. So there is a predisposing factors for you to have this endocarditis. So this one is an example of erysipeloid affecting affecting the fingers. Okay. So, an example of a pig that is infected with erysipeloid. So, how do we identify this? So, they are primarily catalase negative. So, you won't mistake it for Listeria, which because Listeria is catalase positive, and then they could produce hydrogen sulfide on TSI, and in culture. And in culture, they would require carbon dioxide for growth. So this means that Erysipelothrix would primarily be a capnophilic organisms since they would require CO2. So they could grow in blood agar or in chocolate agar. The colonies may appear gray or translucent, and they are alpha hemolytic, pleomorphic, gram-positive thin rods that may form long filaments. They could occur in single or in short chains or in a V-shaped arrangement. So that makes them pleomorphic, such as this. So they assume a variety of shapes. So you could see the long filament, then the V shape. Okay, Erysipelothrix, a single Erysipelothrix. Okay, this one is the blood agar plates showing alpha hemolysis. Okay, more pictures. Okay, so I think I have shown you this before, with the exception that there are other gram positive bacilli that could be added here in the table. That were added here in the table. Okay, so you may refer to table 16-3 of your textbook. Kurthia. Okay, so we're now in another gram positive bacilli. There are two medically important species of Kurthia, Kurthia sophi and gibsoni. So they are aerobic, non-sporulating, motile at 37 degrees. So they are temperature dependent because at 20 degrees or at room temperature, they are said to be non-motile. There are gram-positive bacilli which could be isolated from fresh spoiled meat, water, feces, milk, or, this one is interesting, even air from abattoir. So, pag medyo mabaho pala yung air, so you should be worried because this could be the means of transmitting Kurthia, which, by the way, could cause endocarditis. So, they appear as small gray rhizoid colonies with medusa head appearance. Oh, it could be the same as Bacillus anthracis, okay? But, of course, they are non-spore former. Catalase positive and oxidase negative. They would have this gelatin slope that would result into a feather-like growth. So, medusa head appearance is something that might sound familiar to you because Bacillus anthracis would also have a medusa head colony. So, in the laboratory, there's a chance that you might mistake it for Bacillus. So, for you not to, then you have to remember that Kurthia, unlike Bacillus, does not have spore. They cannot ferment carbohydrates and they cannot liquefy gelatin. Okay, so this would be the pointer. So, for you not to confuse this with Bacillus. Rhosia. Okay, so another group of gram-positive bacilli, Rhosia dentocariosa, is a normal oral flora. Okay, normal oral flora, but could result into endocarditis. So, according to CDC, or Center for Disease Control, Rhosia is classified as the undesignated CDC coryneiform groups, which could result into, or which could cause bacteremia, endocarditis, wound infections, and eye infections. So, aside from the fact that they could cause endocarditis, Rhosia dentocariosa could result into cat scratch disease. So, they are non-motile, filamentous-shaped, catalase positive, nitrate reduction positive, and could hydrolyze esculin. Okay, so again, this reappears for you not to forget, okay? So, very important that you should be able to differentiate Listeria from Erysipelothrix, from Corynebacterium diphtheriae in terms of hemolysis, motility, catalase reaction, and ability to produce hydrogen sulfide in triple sugar iron. Arcanobacterium is another example of gram-positive bacilli, a catalase negative that could produce a narrow zone beta hemolysis. So, one of the distinguishing characteristics of this is that there would be black dot. Okay, for example, that this would be the colonies of Arcanobacterium. So, there would be black dot. Okay, it's not a dot. Anyway, let me redraw it again. Okay, so if this is the colony of the Arcanobacterium, yan. So there would be a black dot. Okay. Oh, why did I read? There is an actual picture actually of the particular organism, the black dot appearance, and the picture looks better than my drawing. Anyway, this illustration here is the gram-positive bacilli. Okay, gram-positive bacilli of Arcanobacterium hemolyticum, Gardnerella vaginalis. Okay. So, girls, you have to be wary of this particular short pleomorphic gram-positive bacilli, or sometimes in Coccobacilli. This particular organism could stain, are said to be gram-variable because sometimes they are gram-positive, sometimes they are said to be gram-negative. So, we call it gram-variable. Why girls? Because this could result into vaginosis, or the bacterial vaginosis, wherein there would be a malodorous discharge coming from the vagina, and usually the vaginal pH would be greater than 4.5. So if for example the doctor would be doing the pap smear, okay, one of the things that the pathologist would be looking into the pap smear of girls or of women with vaginosis is the presence of clue cells. I forgot to paste the illustration of clue cells here, so you might as well Google image Gardnerella vaginalis clue cells so that you'd have a clue on how Gardnerella vaginalis clue cells would look like. So anyway, the treatment for Gardnerella vaginalis would include metronidazole and clindamycin. Okay, so this is now the Nugent scoring system for a gram-stained vaginal smear. Okay, so this is being used by cytologists or by pathologists in grading the vaginal smear. Okay, so they would be identifying Lactobacillus. Okay, so if you have more Lactobacillus, then you won't have any points. Okay. Gardnerella vaginalis, the point system is the opposite of Lactobacillus. Why? Because Lactobacillus is considered as a beneficial microorganisms in the vaginal smear. So, the presence of Lactobacillus would usually inhibit the growth of other pathogenic organisms. So, the more Lactobacillus that you have, then it means it's better. No points. Unlike if you have more Gardnerella, Bacteroides, or other pleomorphic gram-variable or gram-negative short bacilli, the more that you have, then you'll have a higher point. If you're able to see Mobiluncus morphotypes, means that you're able to see curved gram-variable bacilli. So again, more of them would result into +2. So how would you interpret? Okay, if your score is between 0 and 3, okay, it means that you have a normal vaginal microbiota. Yay to that, hooray to that. It means that your vaginal flora is clean, or should I say, free from any potential pathogenic microorganisms. So, you have more lactobacilli. But you won't be saying, okay ka ba chan? Okay, that's a different thing, okay? So, if your score is between 4 to 6, means that you have the indeterminate bacterial vaginosis. It means that the doctors won't be convinced that you have vaginosis or not. It's like you are in the borderline or in the brink of having vaginosis. So that's it. But if your score is between 7 and 10, so congratulations, you have bacterial vaginosis. Good luck to that. Good luck to your partner. Because you'll be exhibiting malodorous discharge from the vagina. And this would be a panic result for any women, okay, for any woman for that matter, because of the fact that vaginosis is a serious condition. Okay, it may reflect the hygiene of the woman regarding the cleanliness, okay, of her vagina. I'm having difficult time saying that thing. Anyway, cultural characteristics. So, sheep's blood agar or chocolate blood agar could be used at 35 to 37 degrees. We could also use human blood bilayer twin agar. And this is considered, by the way, as the medium of choice for Gardnerella vaginalis. Okay, so let's continue. We have here an example of aerobic actinomycetes, the Nocardia species. So obviously they are aerobic gram positive filamentous rods. Okay, what strikes me the most here for Nocardia is that they are weakly acid fast. Okay, which means that they might have a very small concentration of mycolic acid in the cell wall. That makes them a weakly acid fast and maybe gram variable. Sometimes you might mistake this for fungi because they may also have branch hyphae. So hyphae is an important characteristic of fungi. Hyphae. Okay. Then in culture and in types of infections, so they may resemble fungi, generally found in the environment, but those that are immunocompromised are mostly affected by Nocardia. Okay, so these are the different staining characteristics of Nocardia. So as you can see here, this is the gram stain. Okay, so they might be gram variable. Okay, but this is the acid fast stain. So as you can see, the organisms are acid fast positive, or sometimes books would call it weakly acid fast, and there is the characteristic branching filamentous hyphae. Okay, so this if you are infected with Nocardia, you'll be able to isolate the organisms from the draining sinus tracts, wherein you'll be able to see granules. So this is an example of the sulfur granules collected from the draining sinus tracts. Okay, so that is the infection of Nocardia. So they are slow grower. It will take them about 3 to 6 days, primarily affecting immunocompromised individuals. But if you are immunocompromised and you are infected with Nocardia, the mortality rate is high, for about 40%. Okay? So, Nocardia asteroides would usually result into pulmonary infection. So, in culture, Nocardia asteroides might have the breadcrumb colonies, the same as the Mycobacterium tuberculosis. So, the mode of transmission is by inhalation of organisms, usually from dust or from soil. Nocardia brasiliensis results into cutaneous infection. Mode of transmission, if there's a trauma or cuts or wound in the skin and then the skin has been contaminated by nocardia, then there's a chance that you will get the infection and it will inadvertently result into destruction of tissues and bones. Okay, so this is the colonies of nocardia. So, and blood agar plate. So, sometimes this is referred as the breadcrumb colonies. Okay, so these are the different aerobic actinomycetes. Okay, so you have the actinomadura, gordona. By the way, Mycobacterium is also considered one of them. Nocardia, Rhodococcus, Streptomyces, and Chucamurella. Okay, so identification of Nocardia and similar species. First, you do microscopy. So, you might consider gram staining. So, you'll see branching filaments. Okay, you might get the specimen from sputum or from aspirated materials. Then, the organism may show beading appearance. Okay, so paraffin bait test, okay, is one of the tests that could also confirm or screening test for nocardia, because nocardia can break it down as a substrate. Okay, so they could utilize paraffin as a substrate. So imagine a paraffin, the wax-like substance could be broken down as a substrate by nocardia organisms. Actinobacillus, actinomycetemcomitans. Wow, what a tongue twister that we have here. Okay, another example of gram-positive non-motile facultative anaerobe, which occupies normal oropharyngeal region, normally at the oropharynx. This could cause juvenile periodontitis and subacute endocarditis. Other actinomycetes, I think I have already mentioned this a while ago. So, I think I wasn't able to mention this one, the Tropherema, which could cause the Whipple's disease. Not really that common. Then, of course, the Lactobacillus, the microaerophilic organisms. Organic factors are necessary for the growth of Lactobacillus. These organisms are so important in the industry that there is even a society here in the Philippines that is mainly devoted for the studies of Lactobacillus. Okay, I think they call themselves the PS Lab, the Philippine Society for Lactic Acid Bacteria. Okay, we will be having a joint conference with them next year in Cebu. Okay, anyway, there are some species of Lactobacillus that is considered as a normal indigenous flora of the vagina. Okay, the Doderlane's bacillus. Okay, or the Lactobacillus acidophilus. That's the reason why a while ago in the pap smear, if you have more of them, then that will, let's say you have +4 Lactobacillus, so the score would be 0 if you remember that previous slide. So, the acid pH is maintained by normal flora, and they are active fermenters. So, that's the reason why they are very useful in the industry. So, let's say they are being used for the yogurt production or a particular strain of Lactobacillus, the Shirota strain. This is patented by Dr. Shirota, and this is being used in the manufacturing of Yakult. So, homofermenters means that they could only ferment one product, but the term heterofermenters means that this particular Lactobacillus could produce more products other than the lactic acid. So, here is an example of Lactobacillus. Okay. Okay, so that ends the gram-positive bacilli. So thank you very much again for listening. So feel free to share this presentation. Thank you.